I'd like to welcome you to an Avomeen on-demand webinar. Today I'm going to talk to you about the PMTA strategy, which is a quick and effective approach to product selection for the PMTA.
So as mentioned, my name is Derek Beauchamp. I am a Senior Technical Director of Analytical Sciences here at Avomeen. I've been at Avomeen for over 6 years, and over the last 4 to 5 years, I have become a subject matter expert in the nicotine space, particularly related to the PMTA applications. So first, what I'm going to talk about is I'm going to break down the PMTA. So what is a PMTA and what do you need to do? So the first couple slides are going to serve as a background, and the rest of the slides are going to serve and demonstrate some specific applications and parts of the PMTA. So first, what is the PMTA? The PMTA is a pre-market tobacco application that e-liquid manufacturers, device manufacturers need to file with the FDA. They need to file an authorization for a PMTA to be able to sell their nicotine-containing products. This is required for all new products which were introduced on the U.S. market after February 2007. Largely, this means over 99% of all products in this space, which is the vapor space, would require a PMTA. This needs to be submitted by importers, manufacturers of both e-liquids and the related hardware. The FDA requires that all these vape shops, which produce small batches, or custom blended e-liquids to submit PMTAs for each of their SKUs or for each of their products. These tobacco products must take into account risks and benefits to the general population, both users and non-users. For example, one benefit is the secondhand smoke is eliminated with e-liquids. You get the cloud of vapor, but you don't get the harmful chemicals that are in a cloud of a cigarette smoke.
The PMTA requirements. In June of 2019, the FDA outlined a guidance for the PMTA. In their guidance, they talked about product sampling and the labeling required on the packaging, the scientific studies that would be required, the analysis of the products, the principles of operations of the devices, the use patterns and how the users would use the products, how the consumer appeals to the product and the general perceptions of the product, and as well other human factors. The cost to do a full PMTA for approximately one SKU is around $1 million. This seems like a large amount of money. However, there's a large amount of data that is required to be generated, processed, and analyzed. Some companies may find this very cost prohibitive. However, there is no guarantee that an e-liquid or an ENDS device will receive a favorable authorization. The FDA could reject a product for any number of reasons. The one aspect where a product may be denied for could be because of the generation or the product has HPHCs. HPHCs are harmful and potentially harmful constituents. These constituents can be present in the e-liquid itself, could be generated through the aerosolization of the e-liquid. They could be produced over time, so when the product sits on the shelf, these could slowly form. Extractables and leachables testing failures. So this is how the product, or this study shows how the product interacts with the packaging, and there are instances where components from the packaging could leach into the e-liquid, and those could be considered potentially harmful. One other way a product could fail is through product marketing, packaging, clinical, or toxicological issues. I'm going to talk to you about the composition of an e-liquid. So what is in an e-liquid? E-liquids are supposed to contain propylene glycol, otherwise known as PG, vegetable glycerin, known as VG, nicotine, and flavor components. These flavor components can be both synthetic or natural. E-liquids, however, may contain heavy metals, carcinogens, HPHCs, or specifically banned flavor components. If an e-liquid contains any one of those four things, it may be outright rejected for a PMTA. How can we manage risk, or how can risk be mitigated? To assess the prospect of an e-liquid or an ENDS device receiving favorable market authorization, a company could undergo some relatively inexpensive and quick chemical testing. The first of these is product deformulation or reverse engineering. This study would allow a user, a company, a manufacturer to understand every component in the product. They could do some quick screening of the e-liquid. They could do a HPHC screen, just looking as a quick check to see if there's anything in there before invoking or before going down the road to do the full product HPHC testing. Or if it's a device, they could aerosolize an e-liquid and they could see if their device is contributing to any of these HPHCs or other banned components or substances. We're going to talk specifically about deformulation. So deformulation is the process of analytically breaking down a formulation to separate, identify, and determine the exact quantities of the major and minor components. Deformulation can also be known as reverse engineering. Deformulation can assess the potential to successfully complete a PMTA based on the major and minor constituents of the e-liquid. If during the deformulation, if something that is known to be toxic is present, a company may choose to not push that product through a PMTA, but rather change that formulation before pursuing a PMTA. They can determine if an impurity is present. If impurities are identified, they could develop an alternate formulation to eliminate those impurities. You can do a deformulation on the final e-liquid product or just the flavor base only.
In our lab, when we deformulate e-liquids, there are multiple separation techniques which we used, which are based on solubility, insolubility, volatility, the concentration of various analytes. These separation techniques are used to both identify and quantify the constituents. So you take these isolated mixtures and we do an analysis of some of the equipment in our lab. One we use is GCMS, which is gas chromatography mass spec to analyze volatile chemicals, high pressure liquid chromatography with mass spec to help in identification of unknowns, ICP-MS or inductively coupled plasma mass spec for trace metals analysis or elemental composition. We can do an FTIR. Please refer to the Avomeen website for a more in-depth description of these techniques. Here I'm going to talk about a case study of a 0 milligram per milliliter e-liquid product. In this particular case, one of our clients was interested in determining the composition of the flavor package for his line of e-liquids, specifically how to build the flavor packages from commercially available ingredients rather than purchasing these pre-made flavor blends from overseas suppliers. We also needed to determine the ratio of PG and VG, so multiple methods and runs were required to fully deformulate the product. As we see on this slide, in the top right, we see a GCMS chromatogram of a glycerin standard. So what this is showing, if we were to inject glycerin into our mass spec using this specific method, this is what it would look like. Similarly, on the bottom is the GCMS chromatogram of propylene glycol. So that was done for one of two reasons. The first one is to see where in the chromatogram the propylene glycol and the glycerin would come out, and also to quantify that, and also to know, so we did not see any major overlap of any flavor components. So we did chromatograms of two products with two flavored products, and we use multiple GCMS methods, and I'm showing you one of them here. Sample 1 on the top, sample 2 on the bottom. We see the large glycerin and propylene glycol peaks identified by the arrows, and we see a lot of small peaks. Those are the flavoring components. If we look for the deformulation output of the two samples, we see that, we see the glycerin, propylene glycol, and I've identified here a couple of the flavoring components in the e-liquids, but just so you know, there are over 40 individual components in these formulations which make up the flavoring. So this would be a complex analysis. The second case study we're going to talk about is a company's best-selling flavor-based deformulation. One of our clients was interested in reverse engineering or deformulating the flavor base used in one of their best-selling e-liquids due to concerns that the material contained carcinogenic carbonyl-based flavoring agents. These include acetone, diacetyl, and acetylpropenyl. These flavoring agents are used to create milky and buttery flavor notes. So these would be potentially present in things like caramel-based e-liquids. Upon the completion of this deformulation, acetone was detected at 7.9 parts per thousand, or 0.79% of the formulation. Acetylpropenyl was detected at 4.7 parts per thousand, or 0.47% of the formulation. Diacetyl was not detected. These two carbonyls that were detected, acetone and acetylpropenyl, were large enough that one of our clients decided that they needed to reformulate their base flavor package in their e-liquid because with these numbers, they would not receive a PMTA. So now we're going to start talking about HPHCs and some e-liquid screening. So understanding HPHCs and what they are. HPHCs are chemicals or chemical components that are present in tobacco products. This includes e-cigarettes, tobacco smoke, or anything that could cause harm to smokers or non-smokers. Every unique product type, whether it's e-liquids, vaping products, cigarettes, must be tested for these HPHC components, their ingredients, additives, and also to understand their properties. There are 93 listed HPHCs, and the FDA is asking to test the 20 different key analyte types, or specifically 33 specific analytes or HPHCs to test for in these new tobacco and e-liquid products. All e-liquid manufacturers must report on each unique product for these specific HPHCs. Screening of e-liquids for HPHCs. During the course of developing and validating Avomeen's own PMTA analytical methods, Avomeen screened several e-liquid products. So what we did was we obtained samples from various nicotine shops around town, or not nicotine shops, but various e-liquid shops or vape shops around town in both free-base nicotine, nicotine salts at varying nicotine levels. So what we did is we took a random sampling of all the different types of e-liquids that could be sold on store shelves. Some of the products we tested contained components that were on the HPHC list. Product containing components on the HPHC list may be denied this market authorization. So one quick check you can do is you can do an R&D, or what we call a research and development HPHC screening of e-liquids, meaning we are not doing the testing for any kind of regulatory filing, but what we're doing is we're doing a screen up front so our clients and our customers, can look at their products to know if they should pursue a PMTA on that flavor formulation. R&D screening of e-liquids for HPHCs is a common concern. R&D HPHC cost-effective for information gathering purposes. Generally, for the PMTA, 7 replicates of each test is required, meaning every test we do, we need to repeat 7 times. But an R&D screen, testing is done once, twice, or possibly 3 times instead of 7 times. So on this slide here is the list of the HPHCs that the FDA is recommending you testing for. Avomeen has developed and validated HPLC methods using techniques such as ICP-MS, GCMS, GCFID, HPLC, and LCMS for all of these analytes. Please refer to the Avomeen website for more information about some of these techniques. Some of the compounds which could be known irritants, such as compounds such as cinnamaldehyde, one of the components found in cinnamon or cinnamon flavored products, should be tested for as well, but are not required if your product does not contain a cinnamon flavoring. So I'm going to talk quickly about one of the methods we developed for testing for the amount of nicotine in products. So nicotine is, of course, one of the components tested during the HPHC screening. The reason nicotine is on the HPHC is that nicotine is an addictive chemical. So Avomeen developed and validated an HPLC method for nicotine in e-liquids. During the method development, many samples were tested with varying levels of nicotine. As I mentioned before, we went to local vape shops and procured different companies, different nicotine levels, and different formulations in this method development. In all, Avomeen tested 8 samples, and we found that our method was very accurate for the listed nicotine levels on these products. On the bottom here, we see what's called a chromatogram, and we see the main peak at approximately 5 minutes. That is the nicotine peak. So looking at a second HPHC method that was developed here in Avomeen was a GCMS, or a gas chromatography method, looking for some specific analytes. So in this case, this method we looked at was for N-butanol, glycidol, and iso. We look on this page in the top right corner is a GC chromatogram of N-butanol. You see that there are some different peaks. All that means is that when we developed the method, we in our method development, we spiked in, or we deliberately added N-butanol to the products at different levels. So if you look, the green peak is the highest peak, so that was the highest level of addition, and the blue was the lowest. Similarly, in the bottom left corner, isoamyl acetate, as well in the bottom right corner, the signal for glycidol in varying concentrations. Again, when we were screening some of these compounds in our method development and method validations, in one of the products we detected isoamyl acetate. What we did is we confirmed with a standard that it was isoamyl acetate by GCMS. What we saw and noted is one of these products contained isoamyl acetate, which is a chemical on the HPHC list. So previously, what I've talked about is looking at the actual e-liquids, but you can also do some discreening of the devices. So these devices are the pieces of equipment that are used to aerosolize or vaporize the actual e-liquids. Generally, the devices are screened to determine if any element of concern is generated during typical and expected use and operation of the device. The e-liquid to be used in this device is screened in its liquid state to understand its composition. You compare the data from the analysis of the e-liquid to that of the data generated while the product is aerosolized. In our lab, we have an instrument called the smoke machine, which simulates the vaping of e-liquid devices. Again, these new tobacco and e-liquid product manufacturers must report on the HPHCs that were previously discussed for devices as well. I'm going to go do a case study about a company that Avomeen was working with, developing a new ENDS device, or electronic nicotine delivery system. So a company that developed a new liquid and a new ENDS device was wanting to determine if there was anything of concern present in the e-liquid, or if the device itself was generating any components of concern. Initial testing on the liquid revealed no expected components or HPHCs. The amount of nicotine on the label was confirmed to match what we found analytically. The tested e-liquid was then aerosolized using a smoke machine under normal and expected operating conditions. No HPHCs were generated during the aerosolization. However, a large amount of silver was detected during aerosolization. So it was determined that the coils, which is part of the e-liquid device, which heats the liquid in the device, those are generally made of silver. In this case, the silver was leaching into the e-liquid as it was being heated or aerosolized. Currently, this client is currently evaluating results to determine if the amount of silver identified would be considered toxic or unsafe. So they are taking our data that we found and working with a toxicologist to determine if this level is considered unsafe. Conclusions. Deformulation or reverse engineering is a quick and inexpensive way to assess the likelihood of an e-liquid receiving market authorization via the PMTA pathway. E-liquids and devices can be screened to assess potential safety risks. So where do we go from here? If you're looking for more information about the PMTA and e-liquid testing, we've got a lot of information available on the Avomeen website. You can start with the nicotine and tobacco testing area of our site and go from there. If you're interested in having a conversation about how we can support your PMTA submission or testing your e-liquid in general, please fulfill the email inquiries to clientdevelopment@avomeen.com. These emails go to our entire team and they'll put you in touch right away with one of our experts. Thank you for joining me today. I appreciate your time, and I hope to have the opportunity to work with you and to speak with you. Thank you very much.